right, we are live on YouTube.
Okay, good evening, everyone. Glad to have you with us this evening. Again, my name is James Mack. I'm the board chairman, so we will call our meeting to order and do our invocation. Heavenly Father, we thank you for this day. We thank you for this gathering that we have here for our board meeting. We ask you now to give us wisdom and knowledge as we go through making the decisions that will govern this county. We ask that you will be with us. In his name we pray, amen. Okay. As we have done in the past, since this is a virtual meeting, once we have each second our motions, we will have to go through and do an individual vote. So I do want to make everybody aware of that. So once we have done our second motions, we will basically go through the roll call to make sure that we have everyone that will actually be voting. So I need a motion to adopt the agenda for today.
I move that we adopt the agenda as presented. This is Steve Morris.
Thank you. And may we get a second?
I second that. This is Laura Pons.
Okay, thank you very much. All right. Presently, we have Dr. Buckwell. Can I get an eye from you?
He did. Yeah.
Okay. And Dr. Pons? Okay. Dr. Hagler?
Yes.
Myself, yes. And Steve? Steve, can we get a yes from you?
Looks like Chris Bo's done that.
I didn't see you, did you?
He's frozen.
Steve, can you hear us?
He can hear you.
This is Chris Bo. I'll give you an amen.
Okay. Hey. All right. We have.
It's weird. He could hear us before.
Steve, can you hear us?
Yes, I can hear you now. You were breaking up earlier.
All right. Thank you very much. Is there anybody else that has come in since Chris came in? Okay. Thank you very much. I also need a motion to adopt the minutes from our last meeting. We have the minutes from June the 9th, as well as the continual meeting on June the 11th. So may I get a motion to adopt the minutes from both of those meetings, please?
So moved.
Okay.
Who is that? Who's Chris Bo?
This is
Okay, that's Chris.
Okay.
And can I get a second?
Second, Steve Morris.
Okay, thank you very much. And we have a first and a second, and may I have a final vote? So Chris, we'll start with you. Yes vote to accept the agenda? Okay. Yes. Dr. Buckwell? I can't see, so I don't know if he's open.
Yes.
Okay. Dr. Pons?
Yes.
Okay. Dr. Hagler?
Aye.
And myself, aye. And Steve Morris?
Aye.
Thank you very much. All right, we will start with our reports, and we will have Sue Yates to go first for us.
The first report for tonight is a financial summary report that summarizes our projections for the way CHA performed at the end of fiscal year 2020. We had ended the year around $730,000 loss. If you will remember, in April, I brought the board some projections. It was 912,000 was the best that we felt like we could do, and 1.6 million was around the worst we could do. We did receive money from the county. It was 369,540 for the response efforts. So that's how we were able to do better than our best projection. Without the Cabarrus County funds, we would have lost close to 1.1 million. We are pulling our year-end reports together. We are getting ready for our audit. There have been a few things that have came in since the time of this report that puts us down to about $705,000 loss. However, if there are no other significant items, this is where we will end the year. And the auditors are coming in the next month, and then we will get our final reports for fiscal year 20. Any questions about the financial report?
If there's no questions, we will move to the next report, which will be the employee separations, and that will be Erin Shue.
Yes, good evening. Welcome. Glad to see everyone and hear everyone tonight. Each quarter we bring to you our separations report. And so here you can see our fourth quarter separations for our new board members, retirements, those who are moving out of state, and reductions in force do not count towards our turnover rate in terms of how we manage our performance. So you can see our fourth quarter rate was 2.1, and then our annual rate was 9% in terms of turnover. And so we continue to look each and every quarter with every position for any trends, whether it be within a department, a certain position. And so, of course, we have continued to do so now. This was a very interesting quarter given our COVID response, but we're so extremely grateful for the staff that we have and our new staff that have been joining us this summer. Are there any questions regarding our fourth quarter report for staff? Okay, hearing none.
Okay, we will go to the customer service report, which Erin also has that.
Okay, so as a bit of background, we have a robust customer service survey process. It's important for us to get feedback from all of our patients and the customers in the community that we serve. So once per quarter, we do surveys both in the building, so pen to paper surveys, but we also have electronic surveys that we send out to stakeholders. COVID required us to be a bit innovative in our survey protocol this quarter, but as you can see, between this entire year, our fiscal year 2020 overall customer service rating is 97.9%. For this last quarter that we did, or the last survey, we had 100% rated CHA as excellent or very good. So we're very proud of that. We'll continue to do this and ask those that we serve for their feedback. But you can go through the report to see the breakdown of excellent, very good, good, fair, and poor, along with totals by departments. Any questions regarding our customer service survey report? Okay, thank you, and thank you to all of our staff who continue to provide the very best care to those we serve.
Hey, this is Chris Bowe. I just want to say those are exceptional numbers, and you're realizing how difficult it is to maintain extremely high patient experience in our world. It's impressive to see those numbers sustained.
Thank you, Mr. Bowe. We'll make sure that our staff members hear your remarks as well. Thank you.
Okay. All right. Our next report, if there's no other questions or comments, our next report will come from Suzanne Knight, and that will be the annual communicable disease update.
Okay, thank you. For those of you who I have not met, I'm Suzanne Knight. I'm the clinical director here. Tamara Staylor is our outgoing communicable disease manager. She has just recently, well, she's been working in COVID response for several months now, and she's just recently accepted a long-term position up there. But she's put this this report together. We we typically report in June for the previous calendar year. There's a lag time in reporting communicable diseases from the state. We get our information from our state reporting system, and it takes typically about a quarter to get the information, and that's why we have been doing this in June. Usually this year we were a little bit behind, and so our apologies for that. But we put this together. So there's about 70 or so reportable communicable diseases, and that fluctuates year to year. And what we've listed here are the ones that we have some numbers for in Cabarrus County. Obviously, or hopefully, we're not going to report on all of them or have numbers to report for all of them. And so we've just listed the ones that we do have numbers for. We have highlighted some of the ones that we've had, a bit of an increase in. You'll see usually the same ones year after year: chlamydia, some HIV, syphilis, the usual culprits, unfortunately. And we had some invasive group A strep. We had 8 cases. I do have a typo in the narrative about that. Invasive group A is typically something that you see more often in long-term care facilities. This past year, of the 8 cases that we had, only 3 of them, surprisingly, were in long-term care facilities. And it says in the paragraph that it was of the 9, we actually only did have the 8 cases. This calendar year that we're currently in, we're seeing more cases in our folks that are IV drug users. So that's something that we're really taking note of, and really hoping to be able to target with some wound care assistance, perhaps with a nurse down in syringe exchange, is some of the things that we're looking at. We didn't have any of those cases in 2019, but that is something that has really upticked in 2020. So that's sort of an interesting phenomena. Hepatitis C only became reportable in North Carolina in 2018, so a couple of years ago. So those numbers upticked in that time, and they're sort of leveling off now. Again, that's another test that we are really, I don't want to say pushing, but we're, advocating for with our population that we serve in the syringe exchange. They can be tested for all of these HIV, syphilis, as well as all the hepatitis tests for free. And if we can get them to agree to a blood draw, we really encourage them to be tested for all of these at the same time, and really get into treatment if the tests are positive. And then, of course, gonorrhea and chlamydia continue to rise in Cabarrus County. The age group that we're seeing the most rise is in teenagers, specifically African American teenagers, both in Cabarrus and Rowan County. And for us, it's, of course, here in Kannapolis. And so some of these areas that we really are planning to target in this next year. Anybody have any questions about the report?
Yes, Dr. Hagler. Basically your STDs have doubled in 5 years. The county population hasn't. I mean, some of that we can co-associate with, with drug abuse, but looking at the trends, I would say it's more correlated with undetected sexual activity than it is with anything else. Unless there's other issues I don't know about in the community. That's really what stands out. Everything else is pretty well stable. You're saying that's young, that's teenagers, with or without drug abuse? Is it always associated with that?
I'm sorry, you really broke up. I heard you say that it's doubled in 5 years, but I didn't get a lot of the rest of that.
Well, I mean, it's pretty clearly sexually transmitted looking at the different diseases.
Uh-huh.
More so than drug related, unless they're both going together.
Oh no. So the other, we do know that there are multiple testing sources other than obviously other than the health department and other than private physician's office, other than the emergency room too. There's multiple other testing sources for STDs that also don't necessarily provide the follow-up, that have opened up in the last couple of years, kind of like these fast stock places, I guess you could call it. And those, so they've had a lot more reporting. So we've seen definitely an increase in reporting of STDs. That has been one source that we had not seen 5 years ago. Probably in the last 3, we've seen that increase. But I'm not saying those are not necessarily related to the drug use at all. They may be, but they're not. That's not where we're seeing them from.
So to Dr. Hagler's point, if I may, it would be, and I don't know what the source of the data is and how much granularity there is to it, but to the extent that there is drug use associated with any of these, that would be really helpful. And in a more general sense, I'm just curious as to whether or not there are further demographic breakdowns that help you to target specific populations for preventive, whatever preventive activities could occur to help bring some of these down.
There are other places that we can get more granularity. Yes, we can get to that. It's not in the specific place where we got this general information, but we are able to get to some of that data. A couple of years ago, we were able to heat map where the STDs were concentrated through a special, we had some limited use of some software, and we're able to target that. And hopefully with more time with our epidemiologist, we're going to be able to spend more time doing that. Once we don't have this huge COVID in front of us, we'll be able to spend more time with that. But that's definitely been on our wish list for quite some time.
That's helpful. I think to whatever extent there is additional deeper data that helps to target interventions and activities that are preventive in nature, just would be wonderful for us for you to have.
Agree. I definitely agree with you, Mark. And when we had that data a few years ago, it's not a huge surprise that it's in the same geographic area that, our COVIDs are, that there's so many other inequities. And that's where the high rates of GC and chlamydia are as well.
Any other question? I'm sorry.
No, I was just saying thank you.
Okay.
Any other questions?
Okay.
Thank you.
Suzanne, thank you very much, Suzanne.
Thank you.
Our next item on the agenda would be the consent agenda, and that will be presented by Sue Yates.
The budget revisions are on the consent agenda. This month we have 6. Based on Mr. Spitzer's comments last month, I did a summary in the agenda item, which kind of lays out the dollar amount of each one and what it's for. So I do hope that's helpful. Any other suggestions or feedback would be welcome. Of course, the biggest difference in this particular revision request is additional funding for the COVID response. Are there any other questions about the budget revisions for the month of August?
Sue, the only thing I would say is I appreciate the summary. That was very nice evolution for you to add in there.
Yes, Miss Berry also helped me brainstorm some ideas, so thank you.
Okay. Are there any other questions or comments in reference to the consent agenda?
I agree. I appreciate the extra work that you guys went to. It really helped to kind of focus.
Thank you very much.
Okay. If there are no other questions and comments, may I get a motion to accept the consent agenda?
So moved.
Second.
I'm sorry, what did you hear who that was?
This is Kim Taylor.
Okay, Kim, Dr. Dale. All right, so that was the, may I get a second?
Second, that's Mark.
Mark, all right, thank you very much. All in favor, and I will go down the list. Chris Bowe.
Aye.
Dr. Buckwell.
Aye.
Dr. Taylor.
Aye.
Dr. Pons.
Aye.
Dr. Hagler.
Aye.
James Mack, aye. Mark Spitzer.
Aye.
And Steve Marsh. Thank you very much. Motion carries. We will now move to the business agenda, and Dr. Coyle is up next on the schedule for the board meetings for 2021.
Good evening, everyone. I want to just stop for a quick second and welcome Dr. Cathcart, our new HR director. He has joined us from YouTube, and I understand he's listening in. So he starts on Monday, and we're really looking forward to having him as part of our agency. So the board schedule for this year is in your packet. We have kept the meetings scheduled as virtual through the remainder of this calendar year. We would love to see things get under control and maybe change a few of those into in-person meetings, but we have tentatively put them in the virtual category. Just want to have all of you see these dates and start to put them on your calendar and let us know if anything looks like it might not work. I do want to draw attention to the September meeting. It would fall on September 8th, which is the day after Labor Day, and just wanted to do a quick check-in if anyone saw that as potentially a problem because of being away or unavailable. If you could just say something now, otherwise we'll keep it as September 8th. Comments on that? Okay, then the other topic would be in December. We normally will hold, we don't necessarily have a formal board meeting, but we have more of a holiday social. We will keep that tentative until we see where things are going with our COVID pandemic and talk about that at a later date.
Thank you very much, Bonnie, as far as the board meeting schedule. And again, hopefully everyone can get those dates and put those on the calendar. And we also have another business agenda item, which is health equity and racism. And Dr. Coyle is going to also discuss that area.
Bonnie, this is Mark.
Good evening. Hi. Yes.
We also have an annual recognition of anniversaries date, if I'm not mistaken. I don't recall what time of year it is, but I think it would be great if that date were to be established so that we can also save it on our calendars. I was lucky enough to attend that 2 years ago, and it was really a nice event, and I think board members would benefit by being there and showing their support to those that are being recognized for their anniversaries.
Okay, I'm receiving word that that's normally in January, and we will get that date firmed up and out to everybody over the next few weeks as we again watch our trends and see if we're going in the right direction. So I'm actually going to be joined for this discussion item by Betty Foe, who has done a wonderful job putting together some of the slides. So thank you very much, Betty. I just want to introduce the topic. I thought this was an important issue for us to address as a Board of Health. So we're going to present a little bit of information and then have a couple of points for discussion. But I would like to propose that we consider, as a Board of Health and as a health department, recognizing and proclaiming racism as a public health crisis based on the events of recent past few months. Go ahead, next slide. When I started here, I came here in April in the midst of a COVID pandemic, which was a little overwhelming, just to say the least. And then within about a few weeks to a month after that, we had much of the, the violence and the racial tensions that occurred with the killing of George Floyd, and so that raised some very interesting discussions here in our agency as some of the staff started coming forward and talking to our mental health staff about how upset and stressed and angry they were. And so we held some listening sessions to really spend some time with staff and understand how everybody was dealing with things. And it has been a really eye-opening and rewarding, yet also emotional time for myself, and I think some of the other leaders here, as we really grappled with what is happening in our country. And I think this is a wonderful quote from a public health scholar who is, really summarizes, in public health, we often just keep redefining what we see as unacceptable, and that becomes our focus area. And while we haven't thought maybe much about racism or health equity in the past, it is unacceptable, and it is creating health issues and coming to the forefront. So next slide. Just to show this very quick slide about how equity has been addressed in the public health realm over the past 40 years. The very first set of national objectives, called Healthy People, the Healthy People series, back then it was Healthy People 1990, came out in 1980 and did not in any way talk about health equity, racism, discrimination, nothing, no mention. In 1986, the first national office was created addressing minority health, racism issues, and the Office of Minority Health. And then in 1990, Healthy People, which now is 2000, first included language to the effect of, we want to promote the health of Americans and reduce the health disparities that exist between different subgroups, races, ethnicities. That was, again, included in 2000, but changed not just to reduce disparities, but eliminate them. And then in 2010, the language was changed a little bit more as we continued to define what unacceptable was in public health, and included achieve health equity, eliminate disparities, and improve the health of all groups. And 2030 is still shaping up, and I think going to be out any day now, but some of the rough draft language looks very much like the 2020 language. So with that, I'm going to ask Betty Foe to take over and present a little bit more information, and then we'll have some discussion.
Okay. Good evening, everyone. Thank you, Dr. Quall, for the introduction. My name is Betty Foe. I am the Quality Improvement and Accreditation Program Manager here. Just to make sure everybody can hear me clearly, please shoot Erin a message if you cannot. In regards to social determinants of health, and how we as an agency are looking at social determinants of health, these are the conditions in which people are born, grow, work, live, and age. And what you see on the screen is 6 determinant areas that reflect the critical components that influence health outcomes in the state of North Carolina. As we go through this slide, or these slide decks, I want you to really take in exactly how racism is implicated in all different aspects of life. Let me go to the next slide. Sorry, I can't see that. No, it's okay. Oh my gosh, this. So when we're addressing systems that are in place with social, okay, here you're on the right side. According to the Healthy People 2020, our nation's health planning document, health inequities are related to the historical and contemporary injustice. According to Achieving Health Equity, requires that we examine and dismantle the social systems that produce injustice, such as racism. The list that was provided before showcases that racial inequities look the same across systems, and these systems contribute significantly to the disparities. Racism is a driving force of the social determinants of health and is a barrier to health equity. Within this slide, you can see that Blacks are 2 to 5 times more likely to have bad outcomes across systems in North Carolina. This is in relation to health, education, criminal justice, child protective services, and economic stability. If we want to say it another way, we can say whites have only 25 to 60% as much of a chance of having bad outcomes. The systems cause disparities regardless of the actions of the people they serve. Some of our fellow cities and states are currently acknowledging that racism is beyond the action of an individual, but embedded in the systems that currently exist, and that create disproportional outcomes for people of color. The list continues to grow every day. These are just a few cities that have been represented by the American Public Health Association thus far. Our neighbors next door, on June 16, 2020, Mecklenburg County Board of Commissioners declared racism as a public health crisis. Charlotte Mayor Vi Lyle also signed the proclamation of racism as a public health crisis, and they have put several different infrastructures in place to make sure that they address these disparities. In regards to the historical context of Juneteenth, basically 46 states and the District of Columbia are marking the day as state holiday, and they're observing it. The state of North Carolina recognized Juneteenth in 2007. Wake County Board of Commissioners and Raleigh City Councils voted recently on June to officially recognize June 19th as a paid holiday. And on June 13, 2019, Concord City Council members proclaimed June 19th as Juneteenth Day for the city of Concord. Juneteenth is a reminder that even 155 years after the last slaves were notified of their freedom, we must still fight together for changing and championing racial equity. That is said by Roy Cooper, who declared Juneteenth a holiday. He acknowledges the progress that still needs to be made in North Carolina and created the Andrea Harris Social, Economic, Environmental Health Disparities Task Force and the North Carolina Task Force for Racial Equity and Criminal Justice, which have several public health professionals who sit on the board. So currently, what CHA has been working towards in addressing racism and addressing these health disparities, and eventually soon being able to eliminate these health disparities, is hiring an HR director with a significant background in diversity, equity, and inclusion, creating an equity position, listening sessions with racial equity Cabarrus, ongoing trainings with racial equity initiative and Faith Institute. So all leadership has been trained with Racial Equity Cabarrus and Racial Equity Institute for the preliminary groundwater training, and also reviewing data stratified by racial and ethnic disparities. We're dedicated to building an equitable future where good health and fair opportunities are outcomes for all. One of the things that we present to you in discussion is to, one, and this is for further discussion, develop policy platforms which address systematic racism and injustice within Cabarrus County, a proclamation declaring racism as a public health crisis, and declaring Juneteenth a paid holiday for Cabarrus Health Alliance employees. I leave you further with this last statement that the Diversity and Inclusion Committee heard today from Tiffany Netters, who is in Louisiana. And she basically said, if our systems are set up for failure, let us create better systems. Thank you.
So I will be talking a little bit more about this during our closed session and some of the goals for the year. I think it's really important that as a health department, we address equity and racism and set some goals and objectives that specifically focus on this. And then also wanted to have a discussion with the board about the possibility of actually creating a proclamation. I think the board of declaring racism as a public health crisis, as many of the other boards of health and cities and counties across the country have done. We've been looking at a number of excellent examples of the proclamations by some other health departments where they have laid out, that this is going to be a focus for the entire year. And so I thought that we could use some of those as go-bys to create a proclamation. So wanted to open that up for discussion with the board and see what questions or comments all of you may want to make.
Bonnie, this is Chip. And first of all, I don't think we got a copy of that presentation, and I'd like to have it.
We can send that.
Not willing to address the groundwater, address the fish, or the boat.
Yeah.
So, and I'd like, since this is the public side of this, and I grossly oversimplify things sometimes, if we would simply as a community work on the discrepancy between the infant mortality rates of Black and brown children compared to white children, I think we would successfully work to eliminate a lot of the issues that are profound in this presentation, and a lot of the sub-issues that are not as profound but as important. So and I know that's a gross oversimplification, but it's too important when you look at the discrepancy between Black and brown children's mortality rate in our community and white children in our community, and the fact that we have the state-of-the-art health system that we have. It is, I don't know the right word, but it's bad.
Bonnie, I'd appreciate it if you could, and Chip, those are great comments. I echo that. If you could you slide back to the proposal? And first, let me just say thank you. Thank you for this presentation, and thank you for continuing to keep this fresh. And one of the things that we've talked about within HRM Health is this can't be a moment where we just drive by and acknowledge that it happened and then keep on driving. We've got to maintain the opportunity in front of us and realize exactly what you set out as the beginning, which is to make sure that all these social determinants are in fact equal, and that, you know, there is no recognizing the disparity, but really eradicating the disparity. You know, for me, we in Atrium Health, we believe racism is a public health crisis. So I have zero problem supporting that fervently.
I completely agree, Chris and Chip, with what you've said. I know that each of you within your institutions is grappling with this and thinking about it and looking to resolve as best you can within the parameters of your institutions. We at the North Carolina Research Campus are as well, and are seeking opportunities and initiatives that will focus on helping the community to overcome this public health crisis. And I think there is no other way to say it than that. And I think that it's interesting to me that now you have in order 3 institutions, that is the schools, Atrium Health, the North Carolina Research Campus, all agreeing with you. And while I believe that this would be great as a proclamation for CHA, and I think we should do it, I want to seek an opportunity, and I'm not sure what the right venue is, for the wonderful partnership that makes up this community to do that, and to proclaim itself, and to have all the institutions that are part of this and who believe in this to sign on and sign up to doing their level best wherever possible to eradicate this as a issue.
For those comments, Mark, did any other comments?
I was recently given a piece of paper that had a list of risk factors that you could add up to see if you are low or moderate or high risk, to give guidance to people to go back to work. And it was very chilling to me to see that for diabetes and hypertension and obesity and different things, you got one risk factor. And even for asthma and things with lung problems, you got one risk factor. But for being Black, you got 2 risk factors. And so if you look at the numbers there in Charlotte about how many people have contracted COVID in the African American community and how many deaths there are, I just think that's chilling. And I think, you know, that it just speaks volumes to this issue. So, I mean, I'm on board.
I'm sorry. We're muted. A very good, unfortunate example of how much race can impact health status and health outcomes. It is chilling, as you said.
Develop policy platform. You know, the proclamation, I think, is important for us publicly. Declaring Juneteenth a paid holiday for Cabarrus Health Alliance employees, I think, is something definitely worth us discussing. The other piece of this, too, is let's not miss the opportunity to act in real time when we see the disparity. A case in point, and this is something that CHA has been active in, and it's something that Atrium Health has been active in, but when you look at COVID testing, access to testing, and the impact on COVID of underserved or disparate populations, it is real and is happening today. So I appreciate this policy opportunity, but let's also make sure that as a board, we're leaning into supporting where CHA can impact care today.
So Bonnie, can you flip forward to the fish and the groundwater slide? because I think that's an important slide. So again, we are the CHA is the body that's catching the fish. So I think we're the ones that have to say, you know, these fish are sick or whatever we need to say. But I don't know whether we proclaim that. I think we can say something more specific than that we've diagnosed. We say, as the public health authority, that this is a true determinant of public health. Somehow, I think it's what Steven said. We got to get the people who own the pieces in the middle of the lake to sign on to it. You know, our job is to say the outcomes of all this stuff is bad health. The other folks have to sign on to make the changes that are going to fix it. And I think we've made the diagnosis, and we have to say this is our diagnosis. I guess the proclamation to me is sort of like a fanfare thing, and you do it. I think we can be, maybe that's not the right word, but we can be a position paper, statement of facts, and try to direct everyone else to jump on board, which is, I think, where Stephen was trying to go. If I don't want to put words in your mouth, but I think that was sort of your point, that everyone else that has influence on this in the middle in the lake needs to be on board.
So is this going to dovetail on the community needs assessment summary that will be presented in the community? Because wouldn't there be some issues that would be in common?
Yes. And one of the things we're talking about as part of our whole CHA process, you'll be hearing about that later this evening too, is the need to start to look at all of our health issues with that equity lens on. So looking at the racial and ethnic disparities that do exist. That's going to be one of my objectives to discuss tonight too, is how are we sure that we are looking not just at aggregate data, but looking at trends for different subgroups so that we are eliminating disparities and achieving equity for all residents of Cabarrus County.
So next steps, and again, you said you're going to be discussing this further in your goals and objectives. But next steps, as far as what the board needs to do or what you're going to bring to the board, when will we be looking at something?
Well, based on the discussion tonight, our intent would then be to bring a draft proclamation to next month's meeting. Okay. Present to the board, and in that case, it would be an approval item.
Okay. Yeah. Okay. All right. Okay. Any other questions on the health equity, racism, public health crisis before we move to our next agenda item?
I'll just add one additional thing, and I think Dr. Hagler was suggesting it as well, perhaps if I understood it correctly, and that is that a proclamation is important and it absolutely should be done, but I would like to see CHA and others perhaps come together into a community planning and strategic action effort that says those of us that are in positions of responsibility in terms of the institutions of our community, sit down, pencil on paper, and begin to plan out very actively what it is that we can do to ameliorate this within our community.
Sorry. Thanks, Mark. Again, this will show up in what we see as the goals and objectives for CHA for the next year. We're not just saying we want the proclamation, we want to really focus on that, like you said. So that was great commentary, thank you, and we'll incorporate that into the goals moving forward.
Okay, then we'll move forward with our next agenda item, which will be our COVID-19 update, and again, that will be Dr. Coyle and Eric, she will be presenting that.
Yes, so when we were at our board meeting back in June, we gave a little bit of an update and thought it would be good to give you all a status of where we are now. What you will notice, if you remember the numbers we were talking about back in June, is that as of today, August 11th, we have significantly more cases than we had at June's meeting. We're up to 2,757 cases. And we have had 52 deaths. We currently, for Cabarrus County residents, are at 17. We have about 2,200 recovered, and that leaves us with about 450 active cases. Most of our active cases are not in long-term care facilities. You will remember when we were back here talking in June, really, we were seeing a lot of activity amongst long-term care facilities, but the face of COVID has changed since then, and we are seeing younger and younger individuals becoming infected as the pandemic moved from older long-term care facility individuals into the 20 and 30-year-old age groups as they seem to be getting out and socializing more as restrictions were lifted. Just to show you that sort of trend data, if you will, what we did here is put the status of our COVID epidemic at the end of each month for the past several months. And so just to make a point here or two, if you see, we had our first case about mid-March. By the end of March, we had just 52 cases. Then you'll see by the end of April, we were at 264. By the end of May, we didn't quite double it. By the end of June, we more than doubled the cases. By the end of July, we've even got more and more cases, where we had over 1,000 cases just in the month of July alone. And now in the first 11 days of August, we have added another 400 cases. So we're on track for the month of August to equal about what we saw in July, except we're hoping that we are noticing a little bit of a slowdown, a downward tick the past few days. So we're staying hopeful. You'll see how the deaths have progressed here. And then hospitalizations, about a week or two ago, hospitalizations were at the all-time high. There has been a little bit of a drop in the past week or two, which is reassuring because, you know, that is one of the criteria we always want to keep our eye on when looking at how we are managing the pandemic. We don't want our hospital systems to get overwhelmed to where we can't take care of our residents. And we've been in good shape. Atrium has been an amazing partner and is doing great work. And we are glad to see that the numbers are starting to tick down some, and we'll hope they will stay like that. So you'll see that the number of active cases at any one time has been climbing again the past week or so. We're seeing a little bit of a decline again. So we are in the very early stages of what I'm hoping might be a downward trend. We will know more over the next week or two if things are trending down or if they're going to jump up, and you'll see from the next slide what I mean. So this slide shows us the number of new cases on any day, and the yellow line then shows a 7-day rolling average. And so if you were to try to draw a trend line through that yellow line, it looks like it might ever so slightly be ticking down a little bit towards the past couple of weeks. But you'll see there, just the last couple days on the slide, there's tending to also be a little bit of an upward tick. So we're watching that closely to see if we're going to slowly see the downward tick or if we might be seeing a little bit of an increase again. Percent positive tests is one of the metrics that we look at to get a sense of how widespread infection is in the community. You will see that at one point back in late June and early July that our percent positivity rate had gotten to almost 10%, which is considered quite high. To feel comfortable that you're starting to get your epidemic under control, you really want to see that get down to about 5% or less. Actually, you'd love to see it down around 1%, but getting under 5% is certainly reassuring. You'll see that we've dropped a little in the past few weeks, but we're sort of holding right around that 7.5% positivity rate. So going in the right direction again, finally, after quite a number of weeks of going up, but not quite where we want to see us get. Again, this shows you the trend data for hospitalizations over the past few months, and you'll see that there's clearly an upward trend there, though we are seeing the downward tick in the past week or so, and hopefully we will continue to see that downward trend. I'm gonna, at this point, turn it over to Erin, and before she finishes up the presentation, I just really wanna acknowledge her for this effort. I mean, you want to talk about running a marathon, that's what COVID has become. This is it, you know, we're just dealing with a pandemic that seems to keep on ticking here, and it is certainly challenging us here at CHA as well as everyone to keep up with the volume and the cases and all the work that is entailed with this, and Erin has just been doing a fabulous job leading the whole team. The whole team is doing amazing work and working tirelessly and lots of hours to make sure that we are doing the best we can to take care of our residents. So, Erin.
Thank you. All right, well, thank you. It truly is a team effort, and not just within our CHA walls, but our community. So we can talk all about that in a future research project about community response to COVID. So I want to hit on testing availability. As you may recall, in the beginning of this epidemic, there was a lot of focus on the lack of testing. And so we are at a much better point here in Cabarrus County. So wanted to give you an overview of where testing is available. At Cabarrus Health Alliance, we continue to offer testing by appointments on Tuesdays and Thursdays through a drive-through system, so those individuals do not have to come into our building. Atrium continues to provide testing by appointment at the site near the Speedway, which has been really a great asset to our community during this time. Atrium also continues to have the roving mobile unit in our community. We have a call every week with Atrium staff to look at our heat maps and determine where in our community the mobile unit should go based off of cases, but then also looking at indicators in neighborhoods that need those resources the most. Cabarrus Rowan Community Health Center provides testing both at their McGill location and Logan. CVS began providing testing through their pharmacy drive-through weeks ago. Over the weekend, we got word that a local Walgreens is providing testing, actually right here in Kannapolis. Wolf Data off of Cabarrus Avenue provides testing, and then the state is also coordinating testing sites in communities and had one in Cabarrus County as well. So we feel much better about testing availability in our community than we did many weeks ago. In terms of contact tracing, that seems to be really the buzz term over the last 6 to 8 weeks. We were doing all of our contact tracing in-house from day one. That was an option for local health departments to do contact tracing based off of staffing and resources. We never considered that an option. We knew that was very important to do, so we did that from day one. We are now working in concert with the Community Care of North Carolina, and they are funding about 6 contact tracers that are dedicated to Cabarrus County. And so we are able to work in tandem with them to contact trace. So it's certainly been a help to our staffing. In terms of personal protective equipment, this is one of the metrics that we look at. And if you listened to Dr. Mandy Cohen, you know that the state's also watching this metric as well. This is an update from our friends at Emergency Management today. So our only PPE that is low are N95 masks. So we've done additional things, fit testing for other types of N95 masks, using hoods, things of that sort. So we are feeling better about this. This is something that we will continue to keep a close eye on, not only for our COVID response and for testing, but for our other services as well. You know, we've talked about dental, and it's certainly best practice for those staff to wear N95s during procedures and things of that sort. So we are tracking this closely. One of the things we began to look at over the last few weeks are our cases by age. And with schools discussing reopening, we've gotten many questions, both among our partners, but also community members about, you know, can you share with us more data about cases between 0 and 19? On our dashboard, we provide that age bracket 0 to 19, and that's a really wide age bracket, and we recognize that. So we are going to begin breaking that down. So you can see the numbers here. So these are cases by test date in each of these months. So you can see we have more cases in our older children. So our 15 to 19-year-olds, we have a total of 156 cases dating back to the very beginning of the pandemic. And then you can see the totals in the other age ranges. Again, this is information that we will begin sharing. We're doing a little more work on doing some rates of growth and increase as well. So, but this is a point of information that's been requested in our community. So in terms of CHA staffing updates, wanted to share with you where we are from an organization now that we've provided a community update for you. We did have a series of furloughs early in on the pandemic. Right now we have no one out on furlough. In terms of dental, that was one of our departments that was most severely impacted by COVID. We resumed full restorative dental care with all the COVID precautions in place July the 20th. So that has been a gradual and very careful ramping back up. Dental then resumed hygiene appointments on July the 31st. We continue to have 4 dental staff as part of our COVID response, and that's one of the things I just love about our teammates who are able to be so flexible and nimble and are doing just an excellent job. They will transition back to dental at the beginning of September. Our school nurses, many of them stayed on with us throughout the summer, which was great to have them in that capacity, and we were certainly very thankful for them. But they are transitioning back to school, and I argue to say that it's probably the most important year for school nurses in schools this year. So our staff and our guests are required to wear a mask in our building when they're not at their desk or able to socially distance, and staff continue to be encouraged to telework if their role allows them to do so. Not all roles allow them to telework, but if we have staff that can, we certainly are encouraging them to do so. In terms of leave, we are continuing to offer the emergency paid sick leave. That's up to 10 days of paid leave for qualifying reasons. So if a staff member is quarantining or needing to isolate or have a loved one that they are providing care to that is doing those things, this covers that, as well as dependent care. And we're also providing up to 5 days of the expanded FMLA. So those are things related to COVID. Happy to answer any questions you might have or any suggestions you may have for us in our response or the data that we're sharing. We're constantly updating our website and our dashboards to make sure that the community has access to just as much information as they possibly can.
Aaron, if you go back to the age slide where you're broken down by age groups, there was a substantial increase in the 5 to 9-year-old category between June and July. Any thoughts on what may have driven that?
Well, there were no, what we do know is there were no clusters or outbreaks in Cabarrus County daycares or camps. So that's many of the questions when people see that, they say, oh, we must have had something in a place where children congregate. We have not, knock on wood, we've been very lucky. But what we do know is that many people are simply getting COVID fatigue. And we feel like throughout these summer months, that is what has happened, not just with our 20 to 39 age group, which we saw substantial growth in also during that same time period, but with youth who continue to be at home. So, you know, it's just been a growth in all age groups, but you are correct in that we're seeing fairly substantial growth in our youth.
Thank you.
Sure. Any other questions? All right, well, I just want to echo Dr. Coyle's comment about Atrium, been a great partner through this. Dr. Hagler, really glad to have you on the board after our many times of connecting early on in this event. So as you have suggestions or points of discussion, please do not hesitate to reach out at any time.
Aaron, one question. As far as employee morale, where would you see that at this point based on, I guess, the timeline that we've gone through from March till now?
So the question was about employee morale from March to now. Certainly employees who are part of the COVID response, there is a mental exhaustion as part of it because it is, it's 24/7. You know, you come in the morning and you expect to maybe see some progress by the end of the day, but those lab results keep coming in. So we have tried to acknowledge staff in a number of ways. We've encouraged staff to take their vacations. You have to step away. I think we can continue to support staff, and we should continue to support staff, but it's certainly a challenge with the volume that we've seen over the summer months. Do you have anything to add?
I think that sums it up very well. It's a very spirited team that keeps on doing what it takes, but you know, the 7-day-a-week pace is problematic.
Great question.
If there are no other questions on the COVID-19 information, we'll move to the Finance and CHA Policy Review and Revisions, and that will be Sue Yates.
So exciting finance policies to follow COVID response. Every month we have policies that we bring you for review. Finance is driven by policies to make sure procedures are in place that are followed to ensure our information is accurate. This month there are 4 policies and there were no changes. These are for the board to approve and provide input if there are any comments.
Any questions or comments on the review and the revisions of the policy since there were no changes? If not, may I get a motion to accept the policy review? I'm sorry.
Dr. Buckle moved.
Okay. And second?
I'll second. Laura Bonds.
All right, thank you very much. All in favor, and I'll run down the list. Chris Bowe? All in favor, Chris Bowe?
Aye, sorry about that. I was trying to get off mute.
Dr. Buckwell?
Aye.
Dr. Dale?
Aye.
Dr. Pons?
Aye.
Dr. Hagler?
Aye.
James Knight, aye. Mark Spitzer?
Aye.
And Steve Morris? Thank you very much. I guess that was aye. Motion carried, and we'll move to the next agenda item, which will be the North Carolina Governor's Highway Safety Program, local government resolution, and that will also be presented by Sue.
We have a grant with the Department of Transportation regarding highway safety with our youth. this is the third year. Each year, we need to bring the proclamation and the resolution to the board for your approval to accept the funding so that we can achieve the objectives of the grant. So this is the form that is provided to us, and I'm asking for approval so that we can accept the grant.
Okay. Any questions in reference to the grant? There's no question. Sorry.
No detail in my request, but at a high level, how do we use this money?
How do we, what the money? How do we spend that money?
Yeah, what are we doing to improve driving safety at that age?
We have a staff person dedicated to go into the schools to work with the kids that are learning driver's education. We have purchased some of the simulators so they can see what driving a vehicle would be like, what would happen during a crash. And those simulators are donated to the schools once that is done this year. It was determined to move into some of the non-traditional schools as we had finished up most of the schools within Cabarrus and Kannapolis City Schools. And we are working with the Department of Transportation and the different schools to ensure that this education still reaches the kids in the time of COVID.
Okay. Any other questions? If not, may I have a motion to accept the local government resolution?
So moved.
Okay, that was Mark, and may I have a second?
Second.
And that was Chris. Chris. All right, and all in favor, reading down the list again, Chris?
Aye.
Dr. Buckwell?
Aye.
Dr. Data?
Aye.
Dr. Pons?
Aye.
Dr. Hagler?
Aye.
James Mack, aye. Mark Spitzer?
Aye.
And Steve Morris? Thank you very much. Motion carried. And our next agenda item will be the strategic priorities, and that will be Eric Shue and Betty Folk presenting.
Hang on, I lost my mouse control. Hit it. Up there. I'll lose it when I get there. So just see it in the, yeah, in the board. Is that one? Yep. Okay. All right. Sorry about that. Here we go. So good evening, I'm back again in regards to strategic planning. Just to do a quick overview of our fiscal year 2019 strategic map report, and then we'll go into our next steps in regards to the strategic planning year. So every year we go ahead and present with a strategic map, and we focus on 2 to 3 goals per priority area. Last year, next one. Under our priority area to empower the community, we focused on the goal of producing information to public. I need to put on my glasses. Can't take off my mask, so we'll fog up. Disseminate information to the public on important public health issues and increase the marketing of our services by using multiple media platforms and with cultural competence. So as a result, we had 469 media pieces in fiscal year 2019, which included 238 educational pieces and 231 promotional pieces. The next one. The second goal was to strengthen clinical community linkages and streamline care coordination, particularly access to mental health services and pediatric behavioral health. Currently, Erin Shu sits as a co-chair for the Safety Net Committee, and CHA has been represented at all the hub meetings. Also, 210 staff completed the QPR, which is the mental health training, and 1 CHA staff member is trained to facilitate that. Our second priority area was to promote sustainable health services. Our goal was to maintain and implement a workforce development plan, recognize and utilize competencies to achieve workforce and productivity standards, and determine future needs. All staff completed 2 assessments this fiscal year. The first is the overall Public Health Council on linkages, and secondly, a department/role-specific assessment. Supervisors have also identified specific areas to focus on for fiscal year 2020 based on those results. Next was to improve health equity, expand agencies' technological capacity to improve access to services and expand operations. So we did try to use ProLion, which HR, which is adopted, but ultimately did not work for us. So we went back to using Unisystem and CHA's timesheet. Next one was to improve health equity. That was our priority area, and our goal was to expand the agency's technology capacity to improve access to services as well. A GIS system was implemented with environmental health. Clear Impact software was also used to build department scorecards based on metrics. Following that was operate with excellence to implement plans, policies, and procedures to continued operations. We had prepaid health plans in place, and then the clinically integrated network, the 5 project teams at CHA to drive implementation of Medicaid transformation. And we go. Transitioning to LabCorp for all lab sources, and security plan was implemented with a focus on phishing, multi-factor authentications, and firewall upgrades. Finally, in that priority area to operate with excellence, we enhanced the financial reporting to EMT and board, including annual budget report with more detail to the board, and enhanced supervisory oversight of budgets to assure sufficient funding. You can go to the PowerPoint. So we embarked on our strategic planning process in January and are currently in our strategic planning phase, aligning with our community health needs assessment, our community needs assessment. Okay, and basically this is a timeline of our processes. Today we are here with you to bring the strategic priority selections and to discuss possible goals. We'll be providing examples of goals. In September, we'll come back with a full strategic plan report to the board, and we would like to have board adoption by then. In October, we'll be doing action planning with each department, with supervisors and program managers. And in June 2020, that should say 2021, a year 1 update report to the board.
So I want to share a little bit about how excited we are in that our strategic planning process is so much more robust than it has been in years past. And so we've had more community involvement, more staff involvement, more board involvement in this strategic planning year than in any years past that I've been involved in. And so we are so excited. In addition, this also aligns with the community needs assessment. So Marcella's going to talk to you after we're done but there is just so much synergy around all of these things coming together, along with having new leadership at CHA, that I really can't tell you how excited we are to present this to you tonight and to continue working with you on this. So a few of the resources that we utilize to identify priority areas are very standard with strategic planning. So we did a full industry analysis, worked along with our partner with Healthy Cabarrus, and identified those priorities that came through the 2020 needs assessment. We had a very robust SWOT process. Again, we had staff, board, community members involved more than ever before, and then really did a deep dive into the data, both from primary sources, secondary sources, and then looked at Robert Wood Johnson, our Healthy Carolinians data, and then also our disparities data from the North Carolina Health Equity Report. So from that, Betty is doing a great job of building our performance management system. And so what we're talking to you about tonight is that top bar with the 5-year strategic plan, so the 30-foot view. And we will circle back around with all of these in a few months for you to see how they're all interconnected. But today we're bringing you that 30-foot view with the start of our priorities for the next 5 years. And so what those sources of data, the commentary we got from our focus groups, really led our leadership team to choose the following strategic priorities for this next strategic plan. The first one is to use data to improve health. And again, these are our 30-foot view broad priorities. Developing internal and external practices, programs, and policies that achieve equity. The third is build and sustain collaborative systems that address social determinants of health. And the fourth is to transform agency capacity, culture, and practices to achieve excellence. So what you can see below each of those are sample goals, because we wanted to give you an idea of what sorts of things might be underneath each of those priority areas. So the data is pretty straightforward. We really want to be the primary source of health data in Cabarrus County. We want to be that repository. We want our data to actually be seen through an equity lens. And we want not only CHA to make strategic decisions based off of this data, but also our community partners. So in terms of developing practices, we want all of our programs to serve with equity. We want our workplace to be inclusive, so our employees feel like they are being treated equitably across the board. And then we also want to integrate diversity, equity, and inclusion within our work to continuously improve the health of our community. So then the third, I'm not going to go through each of these. I think you can get the idea, but we really see ourselves becoming much more intentional regarding social determinants of health. So it's exciting to hear some of your comments earlier tonight regarding that. And then also taking a look inside. So what sort of agency capacity do we need to focus on building and making stronger so that we can, in turn, be stronger for our community? So Betty and I tonight are asking the board to formally approve these 4 strategic priority areas so that we can then move forward with our work to develop these goals. And like Betty mentioned, we'll come back to you at your September meeting with the full plan with the goals for formal adoption of the full plan. But we felt like we needed your seal of approval with the priorities so that then we could take that deeper dive into setting goals. Any questions or comments? Okay.
Okay, if there are no questions or comments, may I get a motion to accept the strategic priorities that have been presented tonight? Can I get a motion?
Stan Hagler, I motion it.
Okay, and second? Thank you very much, that's Chip. Okay, all in favor, and I'll go down my list. Chris Bowe,
Aye.
Dr. Buckwell,
Aye.
Dr. Daylor,
Aye.
Dr. Pond,
Aye.
Dr. Hagler,
Aye.
James Mack, aye. Mark Spitz, sir.
Aye.
And Steve Morris.
Uh,
Okay, thank you very much. And our next presenter would be Marcella Beam, and this will be the Community Needs Assessment Priorities.
Yes, and I was going to request permission, Aaron, to share my screen, but I don't see that popping up anymore, so I may need you, or let me see if this will work. Can everyone see what's on my screen?
Yes.
Okay, wonderful. All right, well, I'm going to go ahead and get started. My name is Marcella Beam, and I'm the Chief Community Health Officer here at the Cabarrus Health Alliance. And one of my main responsibilities is overseeing the community needs assessment every 4 years. So we've just conducted it here in 2020. So I'm going to go over with you some of the key findings, as well as some data as to why those priorities were identified by our Community Planning Council. I always like to thank all of our partners, and I think this is the most proud slide that I get to share whenever doing presentations, is the number of partners that are engaged in the needs assessment process here in Cabarrus County. And I would say this is still probably about 70% of them. It's not everyone, but they really are instrumental in us being able to do the process that we do and do it well. We get a lot of recognition from the state as a health department for our collaborative efforts and the level and the number of partners that we have at the table. Next is, this is kind of a graphic visual of the needs assessment process. So I came to you all several months ago and shared with you where we were at and what the process would look like. So I just wanted to touch on this briefly. Forming the advisory group is always the first stage in this. So that's our Community Planning Council. Next, we work on collecting data, both primary and secondary data. We relied heavily on community partners this cycle to help with that secondary data and really pulling local data. Oftentimes when we look at state reports, they could be a couple of years behind. So partners were able to pull directly from the school systems, directly from our law enforcement agencies, kind of up-to-date data within the last few months, which was extremely helpful. We do a community survey for primary data, and we had about 2,900 people complete that survey. 2,700 of those were Cabarrus County residents, so that's the data that we evaluated. And then we do a key informant survey that was about 112 people. Next, that data is analyzed and reviewed by the Community Planning Council, as well as we had a part-time epidemiologist through a partnership with North Carolina Central University, and she was able to help review and pull data as well. And then now we'll be moving into developing the report. That full community needs assessment report is due to the state the first Monday in March of 2021. So I've started kind of pulling things together at this point, and then we'll disseminate findings, which will include community presentations, any way we can do outreach to community partners, but more importantly, community members who participated in the survey, letting them know what the findings were and what the next steps are. Next, these are your top results. So at the conclusion of the Community Planning Council, which ended, we held 8 different sessions for final voting so that we could practice social distancing and have a small enough group. Thanks to Kim Reagan, who's also on leadership team for Cabarrus Health Alliance, for being a part of that process. But number 1 was housing. 2 was behavioral health, looking at mental health, and 3 was education. So looking at early childhood access to child care and also early childhood education. I will say housing and behavioral health were the top, and I think they were 1 vote apart, with education being the 3rd, and then about 5 votes behind that was economic. I will say that COVID was definitely considered in voting, since we did vote in June and July, and the Community Planning Council members definitely took that into consideration. And to, I think it was Dr. Daylor's question earlier about how health equity will be included in the needs assessment process. During the first Planning Council session, the first comment made when we were discussing, excuse me, when we were discussing voting was, you know, how is this going to be looked at from a racial standpoint, an equity standpoint, and access to care and anything? How is that lens going to be put on all of whatever identified needs were selected? And so we made a commitment, 1, as Healthy Cabarrus and as the Cabarrus Health Alliance at that point, to ensure that no matter what needs were being identified, that question and lens and perspective will be put on all the interventions that are identified and how we look at data. And in a few slides, I'm going to go over next steps from the needs assessment, identification of priorities. But I think it's really important to know that we're going to go into action planning, and there are going to be subject matter experts in these fields. Each action planning retreat will be done separately, but there will be questions and there will be data pulled specific to how these priorities look based on who you are and where you live, what your income level is, what the color of your skin is, and how these things impact you individually, so that when we consider interventions, they are appropriate and they are broad reaching to make sure we're meeting the needs of our community. So next, I'm just going to hit on a couple of data points related to the needs assessment so that you have a good understanding of what the Community Planning Council learned. So we have about 8,300 households that are in poverty in Cabarrus County. That adds up to about 22,000 residents, almost 23,000 residents. And so this is just an important understanding when we're looking at this impact on our community and why housing and homelessness was identified as a priority. It's good to understand just kind of what is the breadth, and we really ask Community Planning Council members to consider the magnitude of the problem. We also looked at how much the percentage of increase year over year for rent compared to other areas and cities in our region. So you can see Concord and Kannapolis, besides Mooresville, has the highest percentage of increase over the last year regarding rent expenses. Evictions are averaging about 100 per month, and household foreclosures are 35 per month. I think what's really concerning, and Ed Hosack, if you've gotten an opportunity to hear him speak, does a great job talking about this, but when you've got 100 evictions per month, and you're thinking about kids coming home from school, you're thinking of about 3 evictions a day. And what does that look like for a child coming home from school? And I think that's just a really concerning thing. And we've got data on homeless children as well in the next slide. And then with the Salvation Army, they served 310 unique individuals during the year 2019. I mentioned before about kids coming home from school and there being potential evictions. So from 2017 to 2020, so each school year in between, so for the last 3 school years, 500 or more students have been identified as homeless under the definition of McKinney-Vento between Cabarrus County and Kannapolis City Schools. And then when you think of alternative housing solutions, so individuals that may be dealing with housing insecurity or being evicted, when you think of all the options that they have between public housing, Section 8, apartments with subsidized rent, other subsidized units, and then affordable options, you've got about 4,600 different housing options. But when you have, if you think back to what I just shared a minute ago, about 8,300 individuals in poverty, there's not the amount of solutions to match the need in our community. Behavioral health, so we looked at mental health providers per 10,000 population, and that's 1.7. It is about half of the state ratio. I think they're about 3 or 4 per 10,000 population. This is Atrium Health Cabarrus's ED admission. So you're looking at geriatric, adult psych is in green, and then pediatric. And so this is admissions to the emergency department. You do see a pretty big uptick from 2018 to 2019. And I will say Atrium Health Cabarrus has the geriatric unit for the Cabarrus, for the Atrium footprint. And so that's why we do have a higher majority of geriatric patients, because they are transferred from other hospitals or Atrium hospitals. And then the Stepping Up initiative is something that started at the time that the needs assessment identified mental health last cycle. And it actually screens mental health, it screens for mental health and substance use disorders upon book-in at the jail. This was something started by Sheriff Riley and now carried on by Sheriff Shaw. They've expanded this program to also include someone to provide case management and when individuals are released from the jail. And it's been extremely beneficial to those individuals. I think 54% of those who received a jail screening did not have a mental health or substance use disorder, but that means a good majority did. And so you can see here of those who were screened, how many had a substance use disorder, mental health, and then co-occurring. But I have data, and I wish I would have put it in my notes. There has been a good percentage of those individuals who are case managed after not returning to jail. And I think that's a real benefit of the program. And then the next slide here is going to show you some Cardinal data. So this is individuals who are on Medicaid or uninsured and are receiving services. So the blue line is 3 to 17-year-olds. excuse me, and then adults 18 and older. I will say towards the end where you're seeing that dip start in about May to June, I do think that there is definitely a link between COVID, but I do believe in the next 6 months we'll see a shift there as telepsychiatry and those types of services are used more frequently. But obviously when you look at these numbers, you're looking at around 2,000 individuals per month receiving services. They are not new, unduplicated individuals. They are potentially the same, but this is just through Medicaid or uninsured. And I will say, if you have private insurance, sometimes accessing mental health services can actually be more difficult and more complicated. The next slide is looking at early childhood education. So 63% of children under the age of 6 live in households in which all parents present to work. So if you're thinking about COVID right now and the impact looking at virtual schools, that's why a lot of our child care centers have moved to providing school-aged care. There are 87 licensed centers in Cabarrus County. 58 of those serve children 0 to 5. 23.5% of children in Cabarrus County are in what is called a GS 110 program, and that is not regulated, excuse me, that's as similar to those that receive 0 to 5-star ratings. They're typically church-based programs that are oftentimes half-day. So there may not be the same stipulations for educational requirements within the program or the education and training of the staff. They do still receive an environmental health inspection though. And then average monthly costs or average annual fees for childcare. So this is looking at childcare centers or family childcare, which means potentially within someone's home. So, you know, someone's mom operating a childcare center that they're watching 3 or 4 kids, the annual fees that are associated with those programs. This one to me is really what stood out when we're thinking about individuals that are lower income. These are the different types of childcare options that are available. So you can see 20% are just day programs. When you see evening and overnight services and you think about our second shift or third shift workers, that becomes really concerning. That means that we don't currently have programs that would allow someone to be a second shift employee or a third shift and have access to childcare that wouldn't potentially be a family member or someone operating an in-home service. So that's very concerning. I will share that during the Community Planning Council process, Jamie Tippett-Poe from CK Rider shared that if you are riding public transit and you work an 8 to 5 job, it is physically impossible in Cabarrus County, which public transit is Concord and Kannapolis, to get on the bus, take your child to daycare, and get to your employer by 8 a.m. And I think that that just really shows where there are disparities in accessing, one, a trajectory of employment for someone who's wanting to have a full-time job and their ability to access childcare, but also the transportation barriers that are involved in that as well. This shows subsidized childcare. The wait list is that line in green where you see a dramatic drop. And typically, I think we would all applaud a drop in a wait list, especially when it comes to subsidized childcare. The issue here is the reason for that is individuals who were previously receiving subsidized care have taken their children out of childcare because they are either no longer employed, they've been furloughed, or can't currently afford it due to limited hours being cut and things like that. What is going to be concerning is as the state continues to open back up and people are going back to work in a more traditional sense, accessing that subsidized care and getting put back on that wait list, I think we're going to see that number drastically spike over the next several months as the state continues to hopefully reopen as our COVID numbers go down. So I think that, you know, all of these things combined just really lead for a little bit of a concern around accessing childcare, even more so than before. So I mentioned earlier and showed you this graph. Next steps will be developing action plans. We will start pulling community partners together at the beginning of 2021. Action plans are due to the state in September of 2021. We will look at evidence-based strategies as well as policies or system changes in each of these areas. There already is a Cabarrus County Homelessness Task Force, so I'll be working closely with them on action planning and development there, as well as the county commissioners have convened an early childhood task force. So I'll be working with Ann Benfield and the lead of that task force as well, trying to figure out how to best fit. And then the mental health advisory board that the commissioners convened after the last cycle is continuing to operate. So I'll work closely with Jody Ramirez as well as Sonia Bohannon Thacker and Gwen Bartley. And then I think the biggest thing, and I think it's really important, we talk a lot about data, and I'm pumped that it's in our strategic plan, because that's something that we've got to monitor if we're actually going to make public health impact, is knowing what indicators are we wanting to move the needle on, and how are our interventions aligning to do just that. So that is your update there, and I'm happy to answer any questions if there are any.
I think that was.
Okay.
Awesome.
Okay, thank you very much, my fellow. If there's no questions? Okay. All right.
Mr. Chairman, I do not have a question, but I would like to make a couple comments on the
Sure.
community needs assessment. I would just like to compliment Marcella and her group on the excellent job that they did. The scope of people in the community that are involved in that process is definitely impressive. I don't think that there's any other effort in our community that has as broad a reach as what that program does. And certainly, speaking on behalf of the Board of Commissioners, there are a number of actions that we have taken previously and are currently considering that are directly related to some of the findings of this group and the work that they've done. So I would just like to offer compliments and applause to that group and to Marcella for her leadership and the good work that they continue to do.
Thank you, Commissioner Morris.
I would add to that the fact that there is good, solid, data-driven analysis is really important. So you've got not only data, but a breadth of the community involved. It gives a evidence-based picture of where we are, and I think it's truly a great bit of work.
Thank you very much, Mark. Okay, if there's no other comments or questions, we will move to our next agenda item, which is our annual review of the board's governing documents. And again, you were sent information in your packet, and what we do is each year we take a look at the documents that we have for our board, which would be the bylaws, the corporate resolutions, the operating procedures, as well as the rulemaking and adjudication process. So again, we're just doing a review of this. Nothing has basically changed. But again, if you have any questions or anything that you'd like to mention before we go forward with any motions to accept the review, I would like to entertain those at the present time. Okay, hearing none, I would like to have a motion to accept the annual review of our board governing documents. So may I get a motion?
So moved.
That was Dr. Ponson. May I get a second?
I'll second that.
All right, thank you, Chris. That was Chris' second. All in favor, reading down the list. Chris Bowe?
Aye.
Dr. Buckwell?
Aye.
Dr. Taylor?
Aye.
Dr. Barnes?
Aye.
Dr. Hagler?
Aye.
Matt? Aye. Mark Spitzer?
Aye.
And Steve Morris? Thank you very much, and the motion carries. Our next agenda item, which normally happens yearly in August, is the election or the annual election for the board chairman and the vice chairman. So at this point, the floor is now open for nominations for board chairman.
I want to nominate you, Mr. Mack.
Okay. May we have a motion to accept the nomination, unless there's someone else?
So moved.
Let me get a second. Thank you very much. That was Chris. Reading down our list again. Chris Bowe.
Aye.
Dr. Buckwell.
Aye.
Dr. Taylor.
Aye.
Dr. Pond.
Aye.
Dr. Hagler.
Aye.
I abstain. Mark Spitzer.
Aye.
And Steve Morris. Thank you very much. Dr. Clayton was our vice chairman, so she is no longer on the board, which Dr. Hagler has taken her place. So we do need a nomination for a vice chairman. So could I get a nomination for vice chairman? I'd like to nominate, if I can, Dr. Pons. Are there any other nominations? May I get a motion to accept Dr. Pons as our vice chairman? Okay, Chris, Dr. Buckwell, may I get a second?
Second.
Okay, all in favor, reading down my list for hopefully the last time. Chris Bowe.
The only thing I would suggest is that I think it's a fantastic nomination, and I just want to make sure that Laura is comfortable. And I know that she is pushed in a lot of different directions. I think it's a fantastic choice. I would support it if she would so accept the nomination.
I will accept it.
Then aye.
Dr. Buckwell.
Aye.
Dr. Taylor.
Aye.
Dr. Pons. Oh, okay, so we don't know.
I'm gonna abstain.
Dr. Hagler.
Aye.
James Mack. Aye. Mark Spitzer.
Aye.
And Steve Morris. Okay, so for this year, we will have myself as the board chairman and Dr. Pons as vice chair. And again, I do appreciate the support that you guys have given us from the board thus far. And I'll continue to do my best, and I'm sure Dr. Pons will continue to do what we can do to support you guys as well as CHA. Moving on to our next agenda item, which will be the announcements. And again, I didn't do this at the beginning, but I did want to do this now. We do have our new board member with us, which is Dr. Dan Hagler. So Dr. Hagler, if you want to take this opportunity to just, say some words or just give us some information about yourself, I'm sure the other board members would love to hear from you.
Okay, Dan Hagler. I've been physician in the community, the greater Charlotte community, for over 30 years. I came here in 1987 and actually joined a private practice back when there were such things. I was for those of you who are older might remember the Durwood Clinic, which was down in right by Presbyterian Hospital. And back when everybody went to all the hospitals, I'm an ID doc by training. Dr. Mitchell, who's a neurologist up here that a lot of you know, he and I were residents together. He came down here a year later. I tried to get him to come to Charlotte, and he came to H&M Clinic when that still existed up here, and knew about, I've got transfers and worked with, back when it was Cabarrus Memorial for years. Was the first medical director at Matthews when it opened, was running the practices at Novant for several years, and then flipped over to being a chief medical officer, first at Union about 16 years ago, and then 8 years ago was moved up here to Cabarrus, and have been here ever since. So I've been a physician administrator for about actually now more than half of my physician career, which has been an interesting opportunity, because I do think that you get a bigger chance to affect more people's lives actually than being a practicing physician in a lot of ways. And it was very interesting when I first started my practice. I used to always scratch my head about all of the hospital acquired infections and working on iatrogenic infections and realizing when I was in private practice that it was tough to step on the toes of the guys who sent you business when they messed up, but becoming a chief medical officer, it was a lot easier to address that stuff. So I've always been very interested in hospital-acquired infections and working on that, and that's been a big part of my career since I've been with Atrium. I've been the chair of the infection prevention system-wide for years until we recruited Dr. Passaretti, whom you all know. So that's sort of my thing. I've been worked with the board in Charlotte, worked with the health department in Union County, and glad to be on the board up here in Cabarrus County, which has been my home for the past couple of years. So thanks for thinking of me. And I think I was the last guy standing because I think most of the ID docs were so busy or so tired they didn't have time. And I know your charter says you need an ID doc, so I was the last guy standing up here to serve it, and I appreciate you thinking of me.
We welcome you to the board, and Dr. Pons and I enjoyed our conversation with you when we had the opportunity to sit down and talk with you. So thank you so much, and again, welcome to our board. If there's no other announcements, then again, I would like to ask our vice chair if she would make a motion for us to enter into our closed session.
I will do that. Motion to enter into closed section pursuant to the North Carolina General Statute 143-318, Section A, subsection 6, for the purpose of discussing personnel matters.
Okay, may I get a second?
Second.
Thank you very much, Dr. Data. And again, reading down my list, all in favor, Chris Bo?
Aye.
Dr. Buckwell?
Aye.
Dr. Taylor?
Aye.
Dr. Pons?
Aye.
Dr. Hagler?
Aye.
James Mack, aye. Mark Spitzer?
Aye.
And Steve Morris? All right, thank you very much. If we could take just a short break before we go into our closed session, and then again, we will start, I would say, probably the next 3 or 4 minutes, okay? Thank you, Ryan. We are back into our live session. We have concluded our business meeting for the closed session, and now at this point in time, we are ready to adjourn our public session. May I have a motion to adjourn the public session?
So moved.
Okay, that was Mark, and may I have a second?
Ken Hagler, second.
Okay, I'll take Laura Pons on the second, and I will read down the list. All in favor of adjourning the meeting, Chris Bowe?
Yes, sir.
Dr. Buckwell?
Absolutely.
Dr. Taylor?
Yes.
Dr. Pons?
This was my
Dr.
first
Hagler?
time, yes.
Aye, yes.
James Mack, yes. Mark Spencer?
No.
And Steve Morris? Guys, thank you very much. It is now 8:06. I appreciate your patience as we work through this, and I feel like we got a lot accomplished. So we will see you guys in September. Have a good evening, and please stay safe.
Bye.
Thank you.
All right, take care.
Good night.
Thanks, James.